Greetings, friends and followers. This is Nurses Talking, and I am Del Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I'm very, very pleased to welcome Hassan Alasfoor out of Bahrain. Hassan is a registered nurse and he's an occupational health practitioner working in the oil and gas industry. So welcome, Hassan. I'm sorry, welcome, Hussein.
You're right. Thank you so much, Zane. So happy to be here with you, and I'm so excited to do this interview.
Well, thank you for doing it. But tell me, what brought you into nursing?
So, what got me into nursing? So long story short,
Uh-huh.
2017, I applied into the nursing school, and one interesting fact about my country, Bahrain, is that nursing, it's very competitive to get into nursing. So many people actually apply to enroll into the nursing program.
Hmm.
So I did, and I got rejected. And I tried again for the second time. Like I did not give up on my dreams. I was thinking I would hold on to my dreams, and I got rejected for the second time. It's that competitive. Then I did the third application. I got accepted. I enrolled into RCSI Bahrain. It stands for the Royal College of Surgeons in Ireland, Bahrain's campus.
Hmm.
Uh, yeah, it started there, 2017. Yeah.
Okay. So then I do have a question. You tell me that it's very competitive, and to even to get into nursing school. So what challenged you, either in school or as now you are now working as a nurse?
Yeah. So, if we're talking about like the motive that drove me to
Hmm.
like go into that competition, it would
Hmm.
be so there is a clear influence coming from my mother. She's a nurse.
Ah.
She was an ENT nurse, and I cannot deny that. However, I would like always to say that it was my free will. It was my own passion. I wanted to do it by myself. However, I cannot deny the influence. But yeah, if frankly speaking, there was an influence from my mother, and there was that desire of going into healthcare.
Hmm.
And yeah, as I said, nursing in Bahrain I would say, is a well distinguished profession in my country, and it's a profession that looked to as a respected profession. So it was one of the driving forces for me. Yeah.
Okay, okay. So in many parts of the world, where I am for sure, nursing is still very female dominated. Would you say it's the same where you are?
Absolutely, absolutely. Actually, in whole healthcare in Bahrain is completely female dominated.
Hmm.
Uh, This actually makes a lot of room for male practitioners, whether physicians or nurses, to shine. Actually, it's
Yes.
an easy voucher to just come in. You're just by being a male, you're special. That's it. So yeah, exactly. Without much effort, you know.
Yeah, yeah, I know. I can
Yeah,
get that. I can get
yeah.
that. So, what kind of areas, having become a nurse, what kind of areas did you work?
So I graduated in 2021. It was peak COVID,
Hmm.
and
Hmm.
was a high demand on nurses everywhere. So I applied to so many places, and I found that vacancy titled industrial nurse. I never knew what is an industrial nurse. So I just dropped an application over there, and they were in need for someone to come, and they ended up choosing me. So yeah. And actually, I started my career in the oil and gas field. I'm still there. I experienced other fields as a student nurse. However,
Hmm.
as a professional practitioner, my career was completely in the oil and gas field.
Yeah,
I
all in.
was, yeah, I was aspiring to be to go into palliative care when I
Ah,
was in my undergrad. However, eventually I found myself in an area which is very far from that and working in
yeah.
the desert. So yeah.
So talk to me about a day in the life of a nurse then in the oil and gas industry, because you know what, I think that that is an industry that many of us don't even think about as far as when we're looking at areas where we could work. So what's your life like?
Sure, you're absolutely right. Actually, I think the role of nurses in the oil and gas field is very important. However, it's not very there is no much light shed on that field.
Hmm.
And in many cases, most of the clinics are operated sometimes exclusively by nurses with no physicians actually. They play a huge role, but no one's talking about them. Perhaps they're not speaking up. So, what does the industrial nurse do on day-to-day basis? So, my role is distributed between two major aspects. The first one is emergency response and the daily visits to my emergency room. So we do have a small emergency room in the middle of the factory or the company that I work in.
Hmm.
And so we receive the cases that come as walk-in, and we respond to the cases in the site, which is, let's say, the the core of the job and the most interesting part of the job,
Hmm.
in which you will be responding to cases in the middle of process gas plants, gas compressor stations, petroleum storage sites. So yeah, that would be the major core of the job. Cases would be between chemical asphyxiations, um, people inhaling toxic gases within the process plant, fall cases, very common fall cases, trauma generally. But that kind of cases, chemical splashes is a common injury within oil and gas field as well. So
Mm.
yeah, the other side is the occupational health side. Occupational health side includes so many aspects. One of them would be the pre-employment checkups, is basically the checkup that we conduct for individuals before
Hmm.
onboarding to the company, and the annual checkups, the checkups that we conduct on annual basis to the employees. We do these checkups to detect whether, first of all, to make sure that they're fine, the staff are fine, and to verify whether our control measures that we are applying inside the plant to control the hazards are effective or not. So, for example, as an occupational health nurse or an industrial nurse, one of the duties that you're required to do is to set up, for example, the noise limits,
Yeah.
the limits of exposure to noise inside the process gas plant or the refinery, for example. So you do set up your limits, you make your controls, you ensure that you're preventing people from getting the harm that comes from the noise.
Mm.
However, now you need to make sure that your controls are effective. One of the tools that we do to make sure that controls are effective is to do an annual checkup, including an audiometry for the staff. So yeah, so that's part of the stuff that we do. We work with safety individuals as well in
Yeah.
yeah, in mitigating risks. It's kind of interesting because especially for the safety people, their job is really interesting actually, because they work with healthcare professionals and they work with non-healthcare professionals, and vice versa. Actually, we do the same as well. It's an interesting part of the job,
Yeah.
because when you're working in within healthcare, all people are talking the same healthcare language. However, when you're working in a different setting, you need to, let's say, to adjust your language somehow for them to
Yeah.
understand well. So yeah,
Yeah.
this is all what we do. Yeah, yeah, that's overall. Yeah.
It sounds very, very interesting. So, is there anything about nursing in Bahrain that you think you would like to see change?
Oh yeah. I think actually. there is a large area of improvement within nursing. I think it's not exclusive to Bahrain. I think this is overall, but I'll be
Mm-hmm.
talking about Bahrain. I think there is a large area for improvement within the scope of leadership in nursing in Bahrain. I
Mm-hmm.
think lots of the problems and issues, let's call them challenges, lots of the
Yeah.
challenges that nurses face on day-to-day basis can be heavily mitigated if we looked at them from a leadership point of view. Um, if let me rephrase it, I think there are a lot of solutions that come from the leadership end that can help nurses to overcome those challenges. Uh,
Mm-hmm.
yeah. Uh, so
Yeah.
I think in terms of competency, I think nurses nowadays, especially now the bare minimum of getting a nursing job is a bachelor's degree.
Mm-hmm.
So
That's
in
right.
terms of competency, nurses nowadays are highly competent. In terms of training, nurses are
Mm-hmm.
getting
Yeah.
they're getting into so many training programs. However, when it comes to leadership, there is, I think, no much improvement. There is no much stepping forward
Yeah.
when
Yeah.
it comes to leadership. Yeah.
Yeah, yeah, yeah. And you started out by when you started to ask that question, you said you thought it was a something that is common to nursing everywhere, even though you're speaking about Bahrain. And you're quite correct. This is the sort you're articulating what I hear from nurses all around. The same, we're experiencing the same kinds of things. And you highlighted leadership, and that's one of the things that I see or hear of when I speak to nurses. There seems to be a gap
Yeah.
with leadership. And I think one of the things that contributes to that is that we truly don't develop leaders. We promote people based on experience rather than on development, and that's a problem.
You're absolutely right. You're absolutely right. Somehow we expect managers or leaders to be competent in their role by just a promotion with
Yeah.
no proper training, with no, MBA stuff and such
Yes.
things.
Yeah. Yeah.
And the field of leadership by itself is evolving since ever, How
Yes.
it's not considered in when it comes to nursing leadership. Yeah.
Exactly. 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 So now you work in a very as you described it, you work in a very high, for want of a better word, high tension kind of industry, which says to me that a lot of education is required of people who are working in that industry. You have a lot of educating to do.
Yeah.
So, how do you what kind of strategies do you use to encourage people then to prioritize their health in that industry?
So actually, that's a very interesting question because, we had this conversation a year ago before launching a new awareness campaign in the company. We do that frequently. Awareness
Hmm.
campaigns are always going. So before we started, my line manager, which is someone who I highly respect, actually, I look at him as he's a great leader, actually. So who happens to be a nurse as well.
Hmm.
So before like going into the awareness campaign, his strategy is that we need to educate ourselves first. We
Hmm.
need to ensure that we do have the solid foundation and knowledge required to launch that initiative. So we took 2 months of preparing, just preparing ourselves, just reading, learning. We enrolled into an official training course. So we made sure that we are ready to educate people before like going to people and talk to them.
Hmm.
What we do usually is that we gather our resources. We always make sure that the material that we are delivering to people is um, interesting enough to catch their attention. We always
Hmm.
do that. To us, people learning, let's say, just two things in the span of 2 months is way better than learning 10 vague things, for example.
Yeah. Yeah.
So always make sure that it matches, let's say, their level of comprehension.
Yeah.
And we always give it time. We don't rush. We give it time. We use what we call educational bulletins, basically, I don't like an A4 sheet that has three pieces of information. We circulate it through email. We arrange training sessions. We always give the option for hybrid and in person. We try to make it as appealing to people as possible. And it works, actually, it works. Yeah.
Okay. Okay. Excellent. 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 So I have two more questions for you. One of them is, what advice then do you think that you would give to someone who wants to be a nurse?
Uh, I would say you need to be someone who's happy to give, because that's the foundation of the profession. It's about giving. It's about
Hmm.
being strong to give as well, which is something that highly underestimated. You
Hmm.
cannot expect a nurse to be able to give and provide without being strong independently. So anyone who's going into this profession, they need to have this idea in mind. Strong, being independent, being someone who's willing to give, being someone who's happily willing to give. That's important as well. So yeah, it's something around that, I would say. So yeah.
Uh-huh, uh-huh. So I need, so now here you are. You work in what is potentially a very high stress area. And you just talked about being strong to give, but that takes a lot out of you. So what do you do to care for you?
Nothing much, to be honest. It's Perhaps it's I don't really put the much needed effort, actually. Maybe maybe I really do have a lot of room to work on, especially on that topic. We don't
Yeah.
really we don't really care for ourselves. I think nurses
That
um
is that is very true. And that is the reason that I ask every single nurse, because I think it's important from my vantage point now. There were a lot of years that I spent really um, you know, not taking care of myself, taking care of everyone else. From my vantage point now, I look back and I think, I wish that A, someone had pointed it out to me, because you know what, that's not something that was even thought about. And I suspect that if I had used those two words together, like self-care, in my early days in nursing, someone would have looked at me and, oh, what do you mean? You know? Um, but no, I think that it's important that we remind ourselves that we are just as important as the people we take care of. Maybe more so, because if we're not well taken care of, we cannot take care of them. And their well-being depends on our well-being.
You're absolutely right. You're absolutely right. I'm currently pursuing my MBA, and one of the theories that we discussed was it's called the knowledge doing gap. So
Mm.
it discusses the what we know and how much of it we're doing or
Mhm.
applying. So I think perhaps nurses do know that they need to take care of themselves, but are they doing it? In my case, no.
Not
So
so much.
yeah. Yeah, that self-reflection is very important, and I absolutely agree. You must do some self-care, and I'm delivering this. I'm taking this as a message to myself, and I really need to work on it. Perhaps tell me, like, what do you do for that?
Well, for me now, there are a couple of things I love. I love to garden. If my hands are in the dirt, I am happy. So I do that. I love to walk. I walk a lot. and I love water. Fortunately, I have the opportunity to do all of those things. I live fairly close to water, and I'm
Mm.
walking there. I walk along there very frequently, and I enjoy my garden. So those are my big three things. I do a few other things, but those are my big three things.
Considering that Bahrain is a small island and like there's a seashore and
Mhm.
like 10 minutes away from you there's a seashore. So I think I'll take that advice, to have a quick walk, maybe like every 2 days. Why not?
Yes, yes. Why not indeed? Why not indeed?
Yeah, yeah, absolutely, absolutely.
Hussein, thank you so very, very much for this conversation. We must do it again.
For sure,
Um,
for
any last words you'd like to leave us with?
Well, thank you actually for the interview. It's a pleasure. I'm happy to know you. And I think we are going to do another interview for sure, but like we will replace seats. Perhaps I will be the interviewer.
That will be
'Cause,
just fine.
actually, I do run a podcast show sponsored by RCSI Bahrain. It's titled Future Nurses Bahrain.
Mm,
Uh, it's in Arabic language, my mother tongue, and we target um, fresh graduates, high school fresh graduates who are considering to enroll into nursing. So our objective is to promote nursing as a positive career choice,
hmm.
and we've been doing this. We've been doing. It's under a campaign called Future Nurses Bahrain. We've been doing Future Nurses Bahrain for the past 3 years, and the podcast been running for the since last year, and we had so many positive feedbacks, people watching the episodes, and a lot of people, it helped them to make their decisions to enroll
Yes.
into nursing. It really worked well. Media has a magical influence. Yeah.
Yes, it does. Yes, it does. Yes, it does. And it gets people to actually see nurses in a different light. To date, we have not really been presented in a favorable light. And we ourselves have not promoted ourselves in a very favorable way. And so people see us. One of the reasons I do this uh, created this channel is for people to see us differently because they see us. They have no idea what we do. Basically,
Yeah.
most people have no idea what nurses do.
Or actually, if they do see us, they only see us in our scrubs. They don't see.
Yeah,
Um, there is so many into a nurse other than
yeah,
their scrub personality. Let's call it that. Yeah,
exactly,
yeah, yeah,
exactly. All
yeah, yeah.
right.
So thank you so much for the interview. It was great, actually. It's great to know you.
It was so nice to meet you. Bye bye.